Women's Health Week is a great opportunity to celebrate women's health and particularly to focus on the importance of mental health in women's health.
Often we tend to focus so much on the feelings of people around us that we forget about ourselves and we don't prioritise that. So that's very important.
Women's Health Week is a great opportunity for women to have a little think about their health, to think about issues which might be affecting you, and perhaps a good time to make a good relationship with your GP, which will be so important to you to continue your health throughout your life.
1 in 7 women in Victoria will be diagnosed with breast cancer. Over 90% of those women survive because of the early detection of breast cancer. That's why it's so important to have your breast screen after the age of 50 to detect breast cancer as early as possible.
I think COVID has changed the scope of mental health very significantly. In the community, we know that women are more likely to report anxiety, depression, stress, and certainly in services we're seeing an increased rate of presentation of young women in psychological distress.
Doctors are very concerned that people are not seeking treatment, that people have not been going out and having their regular screening tests. And I think it's terribly important not to let that screening fall behind. So if you are due for screening tests, please organise for them to be done.
We know women have been hesitant about coming to have their breast screen during the pandemic. We have seen a 40% reduction in the early detection of breast cancer. BreastScreen is operating safely during the pandemic. We have had a lot of positive feedback from our clients regarding how safe they felt during their recent BreastScreen visit.
I think COVID has had a very specific effect on women's mental health. Women are much more likely to be juggling multiple responsibilities, particularly with children and with elderly relatives. And often women are prevented from seeking mental health care by virtue of those many responsibilities.
It's easy for women not to prioritise themselves and in particular their breast health. I urge women to be breast aware, and if you have any concerns, please see your GP.
A lot of health professionals now are offering telehealth. They're still accessible and out there, and it's really important that we don't put off any checks or any concerns. I was speaking to a lady who'd come to our physio groups the other day. She'd done them via Zoom, and she was raving about how it was so fantastic that she could do that in her own home. She didn't have to leave the house. She didn't have to put on any lipstick or anything special. That service was right there. She could access it when she needed it.
There are so many good things that you can do to look after your mental health. Some of them are the basics, so things like exercise, having regular daily exercise, which we know is really important, particularly for older women's health. It's also really important to minimise your alcohol and other harmful habits. And the other really important thing is to stay connected. Seek out the people who care about you and can support you at this time.